Hello, welcome to the MPH webinar. My name is Corinne Kyriacou. I am going to be walking you through our new MPH program this evening. If you have questions, please feel free to type them on the screen and we will answer them at the end of the presentation. I'm waiting to turn. Okay, this is a quote from a former Surgeon General, and I think it says a lot about the public health field. It is everybody's business. It's the kind of field that is of interest and importance to people in every sector of society. The specific definition is that it's an interdisciplinary field seeking to prevent injuries, illness, and premature death. Public health really is a science and an art of protecting and improving health in communities through the use of education, promotion of healthy lifestyles, and research for disease and injury prevention. The MPH degree is the most widely recognized professional credential for leadership in public health. It enables students to understand and apply public health theory and research methods. We've come a long way in public health, and we've had some tremendous advances. Some of them are listed on the board. Many of them you are aware of, I'm sure, and every day we're making inroads. There are still a lot of challenges. Some of the challenges that I've put up here are of particular interest to the MPH faculty, and I'll speak a little bit more about that in a few minutes. But health disparities are a major concern for public health professionals trying to increase equity, to improve access to high-quality, affordable health care, to promote healthy aging. We have an aging population and an increasingly diverse older population, and we still have many challenges related to preventing and managing chronic disease. But there are exciting times ahead. Healthcare reform has elevated prevention and wellness to a very high level. There's additional funding. There's new opportunities. The field is expanding. I think of public health as applied social justice. It is one of the most gratifying and fulfilling careers I can think of. It is about people. It's about working with the underserved and underprivileged. It's about making sure that people have the environment, the knowledge, the skills available to make the right decisions, to be healthy, and to live fulfilling lives. It also encompasses a broad and continuously growing range of specialties and settings, whether you have a particular interest in journalism or communications or economics or public policy or medicine. Public health has a role in all of those fields, and so you could find work as a public health professional in any of those specialties. Hofstra's program is new. It's been in development for the past couple of years, although now we are launching it for a fall 2012 start, and we're really excited about it. It is designed to meet the accreditation standards set forth by the Council on Education for Public Health and includes all of the core competencies that the Association for Schools of Public Health require. It's a 42-credit program, and our coursework is in 5 core disciplines of public health, which are biostatistics, epidemiology, social and behavioral sciences, environmental health, and health policy and management. And we also have a number of other competencies that we include throughout the curriculum, which you can see on your slide. And what you should make a particular note about is systems thinking, professionalism, and leadership. These are just so critical, as are the others. But for the current field, how much it's changing and how important it is to be flexible and to be a systems thinking, a systems change, a change agent in this kind of environment. The core curriculum, which includes 30 required semester hours, is divided between methods courses and what we're calling substantive courses. The methods courses are epidemiology, biostats, quantitative and qualitative methods, and program evaluation. As you can see, our curriculum is very heavy on the analytics. We think that teaching and providing students with experiences for applying research skills is essential. It's important that our students and graduates understand how to use data to make decisions about programs and about policies, how to analyze existing programs and policies, evaluate whether they work, and how they need to be modified. And that's really, if you had to define what makes our program different, I think its research focus is critical. Our substantive courses offer training in a general overview of public health in the U.S. health services system, social and behavioral issues, global health, and environmental health. Students are also required to take 2 electives, that's 6 semester hours, and there's a very large and growing list of electives from which students can choose. The existing electives that we have from some of our other graduate health programs include a health communications course, community needs assessment, design and implementation of community health programs, health policy and legislation, health law and ethics, and funding and proposal development. And we're also developing electives around the interest in research and clinical expertise of our faculty. And those are upper-level methods courses, as well as a clinical trials course, a course in chronic illness and aging, looking at suburban health disparities, which also defines who we are here at Hofstra, sitting in one of the oldest suburbs. And we know that disparities that exist are different here than they exist in urban and rural areas. Medical anthropology, disaster preparedness, reproductive health issues, outbreak investigation, and dental public health. So students have an opportunity to create their own little specialization based on their interest and through their selection of the electives. There's also a required internship and culminating experience. Those are 2 separate courses, although they are linked. The internship requires that students complete a project at one of the following types of sites, either at a community-based agency, healthcare institution, a governmental public health organization, or in private industry, where they will be working on assessments, research, or evaluation of some sort, and we will be helping to facilitate that relationship and that placement and working very closely with the students as they spend this time in the field. The culminating experience, which is the final course, it has students kind of applying the work that they learned throughout the curriculum and in their internship by writing a publishable paper, giving a presentation at a professional conference, or writing a grant proposal in a very short timeline. And these are all very marketable skills. We're really proud of our MPH faculty, which drew from the health professions programs here at Hofstra, as well as from the new Hofstra North Shore LIJ School of Medicine, and from our partner, the North Shore LIJ Health System. And we have faculty who have expertise in bioethics and health law and all of the other areas that you can see. I won't read off all of the names. Here the faculty are continued, and they will be teaching in our program. They have been involved in curriculum development. They will be working with students as they're doing their internship and culminating experience projects, and they have also been involved in the development of the program. We are aiming to recruit a diverse class of students. We're looking for very highly qualified college graduates from a cross-section of disciplines, some of which I mentioned earlier. We're looking for professionals seeking to incorporate a population health perspective in their work, any kind of healthcare professional, medical students, residents, and fellows. And it's really exciting to see even the applications that we've just started to get, and our website has only gone live in the past week. And so we're encouraged by the high level of interest already. Here are our admissions requirements. Clearly an undergraduate degree and the transcripts are required. We have a minimum grade point average of 3.0. We do require the GRE. We will accept the MCAT or the GMAT. We require 3 letters of recommendation, a personal statement, and a resume. And we might request an interview if a student is coming to us without any public health or healthcare experience or academic background, although we encourage that. In terms of the personal statement, we're really looking for students to talk about their professional goals, their particular interests in the area of public health, why they want to go for an MPH. For the letters of recommendation, we're looking for letters that talk about the students' ambition, their experience, their professionalism, their analytical ability, in terms of the GRE, I know one of the questions that we've gotten already from the webinar is what the score is that we're looking for. We have not specified a score. It's only one piece of, obviously, this long list of admissions criteria. We are looking for the scores to be competitive, but at this point we are not setting a minimum score. The same with the GPA. We are looking for students that have at least a 3.0, but again, it's one piece of a much larger puzzle, and we're trying to think about this very holistically. Students who do not meet some of those academic criteria but still think that they should be part of the MPH program would be encouraged to write about that in their personal statement. Community partnerships are really important to us. We've been working very hard through our existing programs. We have a Master of Science in Community Health and a Master of Health Administration, and we work very hard to develop meaningful, mutually beneficial, and productive relationships in the community. MPH programs even more so. We want to see that the students are contributing to improving public health on Long Island and the region beyond. We think community partnerships help to enhance teaching and student learning. Obviously, they offer opportunities for students to apply the skills, both research and theory skills that they're learning in the curriculum throughout their classes. Here are some examples of existing community research partnerships that our faculty are currently working on: obesity prevention, looking at autism services for low-income Latinos, doing an evaluation of a program for the uninsured, looking at naturally occurring retirement communities as an alternative option for those who are aging in place. Chronic care management programs such as telehealth and palliative care and falls prevention, and how community-based partners can work together with health systems to make those comprehensive and integrated. Infant injury prevention and breastfeeding promotion programs. We've been working on community outreach and education for pregnant women through the Nassau County Perinatal Service Network, and looking at health promotion campaigns and wellness and prevention efforts among union members as part of a collaboration with North Shore and labor unions in Queens, Nassau County, and Suffolk. I just wanted to make a little plug here for National Public Health Week, which is next week. Ever since '95, President Clinton has designated the first week in April as National Public Health Week, and communities across the country are observing this by doing various kinds of outreach and activities. This year's theme is prevention. You can visit www.nphw.org to see how you can get involved. This is our website address and also my email address, so please feel free. We're going to answer some of the questions that have been posted already, but if you have other kinds of questions or you want to discuss any of the program components with me further, please feel free to email me directly. One of the questions we received just now on the webinar is how long does it take to complete the program? We've designed the curriculum so that the working professional could complete it in under 3 years across 7 semesters. We're really excited about this innovative curriculum that we've come up with that uses both traditional face-to-face programming as well as distance learning programming. And so typically students would take 2 courses a semester in the fall, spring, and the summer. So they're able to utilize 3 different semesters throughout the year, and over the course of 7 semesters they could complete the program. I already discussed the fact that the GRE is a requirement and that we will accept the MCAT and the GMAT, and even if you have graduated or are in another graduate program, you would need to have the GRE. Another question that came in is how many credits can be waived from another master's program. The university policy is that we would accept 9 credits. But if you had come from another program where you've done additional coursework that does look quite similar in content to our requirements, even though we could only waive you out of 9 semester hours, we do have another option, and that is to substitute for you some coursework, so you wouldn't have to retake something you've taken already, but could take additional electives. We do have a rolling admissions process, although right now for this year we're likely accepting students primarily for the fall semester. There will in the future be a deadline for the fall, but since we're just starting our program now, we're going to kind of keep that open. And so I can tell you that we have already started looking at applications. We'll be looking very closely in April and May, and depending on how many people are accepted by June, we may or may not continue looking through the summer, although my expectation is that we will be continuing to look for several months now. It's also open-ended in terms of what size our first cohort will be. We'd like to keep it small. We're thinking about having a cohort of between 20 and 30 students for this first fall 2012 semester. Classes are offered in the evenings, late afternoons and evenings, typically at 4:30, 6:30, and 8:30. They're typically once a week for about 2 hours. In terms of internships, you saw some of the projects that our faculty are working on. We have placed interns in various organizations affiliated with North Shore LIJ Health System, one of the largest health systems in the country that offers a real continuum of care and therefore lots of opportunities for our students. We also have had students at the Department of Health, in private industry, working for community-based organizations through the Health and Welfare Council of Long Island, the Long Island Coalition for Aging, working at various kinds of small and large public and private organizations. We do have lots of resources available for students on campus in terms of assistance with career development, but I can tell you also in terms of the career opportunities, I mentioned earlier that it's really a booming field, it's growing, and the areas that our graduates we would expect them to go into would be in epidemiology and environmental health, going into health services management, etc. Some of the kinds of positions that students have had, just as examples, you could be the executive director of a youth advocate service program or a monitoring specialist for an HIV and AIDS program, a women's health policy advisor for a Fortune 500 company, director of emergency planning, a nutrition health educator, a health communications specialist, the director of government affairs, a senior health economics or management consultant, a global fund program director, or a safety and hygiene officer, just as some examples. For those who have not yet taken the GRE but want to apply, my suggestion is to go onto our website and to begin the application process. You get into the queue and you can submit and upload your GRE scores when they are available, and then your application will be reviewed. There's one question here, somebody who's an English psych major, and are there any prerequisite classes required? I think it's really exciting that we are going to have students applying who come out of the non-traditional healthcare fields, because public health is so interdisciplinary. We need the skills of those who come out of English and psychology and business and communications. I think that's great. And we do offer, introduction to public health and health services courses that I think can help to bring students up to speed. In terms of financial aid, scholarships, and cost, it's really a whole separate division that can answer questions about that. And so if you email me directly, I can forward your request for additional financial aid information to the proper person. Thank you so much for attending this webinar. And we're going to be archiving this information onto our website, so you can always go back at a later time to listen again and to look at some of those slides and to get some of these pieces of information. Once again, I just want you to recognize that what's on the slide now is both the website address for our public health program and my personal email address, and I'd be happy to continue corresponding with you.